Today we're going to talk about kidney stone disease in the human body, specifically kidneys. What does a typical kidney stone patient present with? They usually present with a flank pain, which is a pain on the side of their abdomen, which radiates to their testicle if they're men, or private parts if they're women, and it's associated usually in most patients with nausea and or vomiting. They might have microscopic or gross hematuria, which means blood in the urine, so you have to do a urine analysis. We have to make sure they don't have associated infection, fever or chills, because if they do have an infection associated with the obstructive stone, there is a medical or urologic emergency. About 80% of stones in humans are calcium stones, meaning they're calcium oxalate or calcium phosphate, or a combination of calcium with another ion. Second type of stones are uric acid stones, which comprise about 7% of stone disease in human beings. Uric acid stones do not show up on a plain X-ray film. They do show up and they are visible on ultrasound and CT scan, but on plain film you could have a stone that's even 2 or 3 centimeters and it's not visible at all. The third type of stone, major type of stone we talk about, is infection associated stones or struvite stones, which again they comprise about 7% of the cases. Usually these are seen in women who have recurrent urinary tract infection. And lastly, the least common types of stone, the major one of them is cystine stone, which comprises about 1% of stones seen in human beings, and it's associated with a congenital metabolic disorder in the kidney. The most common sites that the kidney stones get stuck, or there is a hang-up of kidney stone, in the ureter, which is the tube that connects the kidney to the bladder. There are 4 areas. The first area is called UPJ, which stands for ureter or pelvic junction, which in everyday language is the junction between the kidney and the ureter, or the tube that carries the urine from the kidney into the bladder. Second most common place they hang up or they get stuck is where they cross the iliac vessels at the pelvic brim. The third location in men is where the ureter crosses the vas deferens, and in women where it crosses broad ligament. This gets into anatomy, but it's just above the bladder. The most common and the tightest area where the stones get stuck is called the UVJ, or ureterovesical junction, and for that there is a medication, a few medications that we could give the patients to allow them to dilate that area and help them pass the stone spontaneously. In general, if the stones are 5 millimeters or less, with this treatment that I mentioned, which dilates the UVJ, or the junction between the ureter and the bladder now, majority of the stones pass, but not 100%. Usually they pass between 4 to 8 weeks with medical therapy, and the patient has to use the strainer to make sure they pass, because sometimes the stone doesn't pass and the patient's symptoms go away and eventually they lose their kidney. So this is medical therapy of kidney stones. Stone dissolution or dissolving of the stone is only possible for 2 types of stone. One is uric acid stone, which I mentioned, that happens in patients who have acidic urine. Specifically, pH of their urine is between 5 and 5.5. With that, we could give them several medications to increase their pH to 7. And to give an example, it's like putting ice in warm water, and slowly the stone could dissolve, get smaller and pass. Surgical treatment of kidney stones encompasses three things. One is called ESWL, or extracorporeal shockwave lithotripsy, where we don't touch the patient sits in a machine, and with shock waves we break the stone and they pass the fragments. Second is endoscopic treatment or endocorporeal lithotripsy, where we use a telescope, we go to the level of the stone, and majority of times with laser we break the stone, and again they pass the fragments. The third type, which is now almost obsolete, is open renal surgery. Now after the acute phase of stone, what do we do to prevent the kidney stones? About 15% of the patients will develop another stone within the first year, and about 50% will develop another stone within 5 years if they're left untreated, or if they don't do preventive measures to prevent recurrence of stones. For prevention of recurrence of stones, there are 5 simple things that are very, very easy, inexpensive, practical, and it's doable. It's a lifestyle change. The things the patient needs to do: number one, they have to make sure their urine volume in 24 hours is over 2 to 2.5 liters. They have to make sure that the color of the urine all the time, it's not yellow, it's clear. The third thing is they have to avoid animal fat and salt as much as possible. Fourth thing is to increase citrus fruit intake, especially lemon, lime and oranges, because it has citric acid, which prevents stone formation and growth. There used to be a thinking, or the old wives' tale, that patients with calcium stones should not drink milk, but after research it's been proven that actually that is wrong. If they consume dairy or dairy products like milk, yogurt, lebne, jeben, things like that have calcium, it's actually better for them and they produce less stones. So with that, hopefully our goal is to prevent kidney stone formation and growth, and the complications that come along with it. Thank you.